These are spheres, and at the moment we're selling large spheres and small spheres. The small spheres are a little not as polished as the larger ones, so you have different textures. And it's nice to have different textures when you're offering treatment to the body because it stimulates the nervous system differently. These are usually used cold, but you can use them warm as well. If they're cold, you're going to start at the lower jaw or in the hairline. And you're going to go really slow. You're going to go to the parts of the face that have tension or congestion due to sinuses or even headache. TMJ. These are amazing to help reduce the inflammation in that TMJ joint or help reduce the inflammation due to a headache. If it's a cold stone, again, you're going to go slower than you will with a hot stone. And I work with around 8 cold and around 4 hot. I always do a little bit more cold on the face than I do hot. Just let those balls roll around. When I'm done with them, I usually tuck them. The larger spheres are a larger mass on the body, so I typically start it in the hairline or up on the skull somewhere, and then I slowly move myself into the tissue. If you're working with TMJ, you can tap these slightly, creating a little bit of a piezo electric phenomena. Not hard, you'll break your stone, and you don't need to tap hard on that TMJ joint. Let the client help you know the pressure. And again, if these were cold, they would move slow, like I'm doing now. If they were hot, you'd keep them moving. You wouldn't stop a hot stone like I stop a cold stone. They'll equally get hot or cold. So that's why you need some you want in your cold stash and some you want in your hot stash. And again, I'll tuck these when I'm done with them. And there's one of the uses. Now, let's see what we can do in the neck. So these work really nice to do that rolling along that occipital ridge. Try not to pull their hair. Again, if it's cold, it can stop. If it's hot, it has to keep moving. The bigger ones work great along the shoulders. And tucking when it's cool or warm. Another great use is on the hands. You can really get some nice point work, pressure point work in the hand with the sphere. And the client loves the way that just gently rolls along their hand. And you just kind of roll it in your palm and lengthen those fingers. It makes a great little tool for working along the lower part of the arm as well. That aconius that's always tight on everyone, especially as massage therapists. We can have fun on the feet as well. Again, if it's a hot stone, it's got to keep moving and go at a nice speed. If it's cold, you can stop it and hold that pressure point, hold that reflex point. But if it's hot, you can't stop a hot stone. You can stop a warm one, but not a hot one. You can stop a cold one and allow the body to absorb the temperature and receive the pressure that you're applying to that reflex point. You can tuck this along the edge there. Maybe it might sit like that for some people, but most it would just be here, or just put it back where you found it. So let's talk about cold spheres on the back. Again, it's a cold stone. It goes on the body without movement, and then you can move it. Slow. The slower you go with a cold stone, the more therapeutic it becomes. We all have that levator challenge. And this just likes to roll right on over it. And roll into the skull, into that occipital ridge. And it just rolls nicely around the palm of your hand. You don't have to do a whole lot, just kind of keep moving your hand up and down and let that stone roll. For those serratus muscles, all those arms, shoulder griddles, get into serratus, and it's going to unlock that shoulder. Scapular work, subscapularis. It just flips into that pocket just nicely, and it likes to go in the hand. When it's cool, you can roll them down to the hands. One of the reasons you might want to choose to use spheres is because it offers a different vibration to the client with the shape of the stone. Rather than a flat stone or an oval stone, it gives you that sphere, that ball shape. It rotates in your hand nice and easily, and at the time of it rolling around in your own hand, and you're rolling it on the client's body, you're actually doing pressure points on your own hand. And we know all our hands are tired. So, and it's a nice way to be able to also use your fingers at the same time you're rolling a stone on the body, bringing in heat or cold. If it's a cold stone, you can stop it. Hot ones, you have to keep moving. But that sphere gives you that opportunity to utilize your whole hand, your fingers, your thumb, massaging the inside of your own palm as you're getting the work done on the client's body. And you can keep tucking.